welcome to our current webinar series. Today, we are discussing the role of public health in health systems. And I am Evalye Alexander. I am the Career Service and Employer Relations Specialist for the School of Public Health. I will be your moderator today. So we'll go ahead and get started now. All right, so as I mentioned before, welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. The goal of this series is to explore relevant public health topics with members of our communities. And so today we are joined by Nurez Madhany, who was an SPH graduate from 2012. We have Karen, and Karen, you could hopefully correct me on your last name, Mujeyi-Chocho, who was the graduate in 2018, and then Mikeundy, who was an SPH graduate in 2015. And so today, we definitely want to thank them for being here and participating and lending their time to discuss this particular topic. But our alumni, they will present an overview of their careers and share insights about the paths that they took to get into public health and healthcare systems. All right, so let's jump in. What you're seeing in front of you is what the world of the healthcare system really looks like. But according to the World Health Organization, a well-functioning health system responds in a balanced way to a population's needs and expectations. And some of those ways could be by improving the health status of individuals, families, communities, defending the population against what threatens its health, protecting people against the financial consequences of ill health, providing equitable access to people-centered care, and making it possible for people to participate in decisions affecting their health and health systems. And so some of you may ask, well, you know, how does that marry into the world of public health? I mean, if some of it is the same, but a lot of it in the world of public health has more of a broader focus. And that's what we're going to talk about today. Public health, and this is this picture that you're seeing, it actually touches on a lot of variances because it can deal with global health issues, local, regional, just all types of different things, but it does touch on a few things that hopefully some of our speakers will talk about today. So one of the things that we know that public health crises today have highlighted the need for educational and preventative public health services. Now more than ever, we have seen a huge growth and increase in the need of this. The role of public health professionals are essential, and a lot of people are seeing that now. So through the lens of education, research, and preventative training, public health workers have prepared to protect the health of communities at large. And so today, when we hear from our three alumni, they'll discuss navigating the world of healthcare with their public health background and how they are working in their particular spaces to improve healthcare delivery overall. So we'll get started with a few questions. Okay, so I will begin by asking each of our panel today the questions that we have available. So I'll start with Karen. So Karen, can you tell us a little bit about your professional background and how you got to where you are at Anthem today?
Sure. So as Evalye said, I'm Karen Mujeyi. My background kind of took a roller coaster, pronged, forked, travel or journey. When I started in maybe what most of you came in, very novice, said, I'm going to be a pediatrician when I grow up and I'm going to be a doctor. So I went, to Emory, pre-med. And as I finished, I went, hell no, that is not what I'm going to do. But you have to finish, you have to graduate, you invested a lot of money, and I did not want to disappoint my parents. So as I finished my undergraduate degree, I also took advantage and I took some additional courses to say, what else could I do that doesn't take me too far away from healthcare, but also makes me happy, right? So I took some computer science courses and I took some engineering courses because I love math. And I knew that I wanted math in my life and I wanted something technical in my life without fully disappointing my parents. So I did that. I took about a couple of years off because obviously once you graduate, you have financial obligations. And I did not come from a, rich family or even a well-off family. So I had to work. Through college, through my undergraduate degree, I managed to work at Emory. And I was very, fortunate to have worked in their laboratory department. So I did a lot of infectious disease laboratory work. So after graduating Emory, I did manage to work at the Rollins Research Center for many years after that. And so I had a lot of infectious disease laboratory work, genetics work, and that kind of kept me going while I figured out my life. Somebody mentioned public health, and that seemed very interesting to me. And I thought it won't stray me too far from healthcare. So I did. I looked into it. Honestly, I jumped into it not knowing much about it, but it was something that appealed to me and kind of ticked a lot of boxes, right? It was very wide and it could touch a lot of things without having to fully know exactly what you were getting yourself into, right? It wasn't medicine. It wasn't my whole life ahead of me. And I did. And after I got out, to be quite honest, the program within Georgia State gave you the opportunity to do a lot. My practicum and my internships that came out of there, I was able to do some practicums with the United Nations Institute for Training and Research. I was able to do some internships and practicums with CDC and CARE, as well as, some other really neat stuff. So when I came out, I had a nice wealth of experience with a lot of different things. And my first job within months after getting out of there wasn't NGO based. It was with Grady Health Systems as an analyst. And I was able to put my math skills into play. So I stayed there almost a decade. And I was very fortunate that my director at that time really trusted me. And he said, I have a role. I don't know exactly what it is. You get to do with it whatever you want to do with it. And my history kind of led me to go, I have practiced with NGOs, thanks to what Georgia State did with me and what it gave me the opportunity to do. And everything I had done with pre-med as well as with the computer science. And that's where I discovered health IT, to be quite honest. And I got to do some programming, and health IT was what opened everything for me. And I got to do some health IT programming. And that's when I would do presentations to the insurance companies about their data and their patients and their members. I was headhunted by Humana at that point because I would do presentations to them about their membership and how they could improve the health for their membership. And they headhunted me and I went to work for Humana. I would do the same type of presentations about population health management and how to find buckets and how to use data to gain insights about their membership and the health and how the two make sense. And I was headhunted then by Anthem and their digital department because they needed someone to do kind of the same thing, but at a broader scale for millions of their members, not just, pockets of their membership. And now I work at Anthem doing kind of the same thing, but at a much broader scale where we take health data, electronic data, all the EMR data for all their patients, all their members, and we figure out what we could do with that membership data across all the industry. And we do population health management. We do real-time, what can real-time data do in the hands of physicians if they have financial data as well as electronic medical data, and we create applications. We work with Amazon, we work with Google Health, we work with Apple, and we figure out how to make applications with that data if you have it in real time. But when you get all the clinical data, when you get all the statistics data, you get all the stuff that I learned from epidemiology, right? And how do you make sense of it and merge that with health IT and make it make sense to physicians, to statisticians, to data scientists, as well as to engineers, developers, architects, and all the clinicians that need to make health decisions. And that's kind of how I ended up where I am today.
Oh, thank you. That was a great journey that you've taken to end up where you are, and I'm glad you're happy where you are. Can you tell everyone what your title is at Anthem?
So my title makes no sense. I'm a systems analyst, senior advisor, clinical data advisor. And I think that's part of part of my story to to most people is titles at companies make no sense 90% of the time. And so you really have to learn what the company does, because honestly, in the way the world works, they just try to fit something into somewhere. And, technically I'm a product owner. I own the clinical product or the clinical data, and it's my job to make it make sense. Right. So my pay title is a systems analyst, but what I do is I own the clinical product.
That makes a lot of sense. It makes a lot of sense. Okay, cool. I do have another question for you, but I think I'll save that one closer towards the end so I can give everyone some time to speak. But thank you, Karen. I really appreciate that. Okay, so Nurez, will you tell us a little bit about your background?
Sure. Good afternoon, everybody. Thank you for having us, and thank you guys for joining. So public health was actually a career change for me. So similar to Karen, but long before she was there, I was at Emory as well. And I was pre-med and failed organic chem, so that changed very quickly. After college, I was in the hospitality industry and managed and owned bars and clubs and nightclubs, and then decided that, hey, you know what? I want to do something different. I heard a young lady speak about what she did at the CDC, was enamored by public health, and then went on a journey to figure out what I wanted to do and how I wanted to do it. Georgia State allowed me to design my own program with a master's in public health with a concentration in policy and management. I was able to also earn certificates in disaster management and nonprofit management to go along with 20 years of business and ownership and management experience. I was able to do my practicum in India, which was really cool. I worked in rural villages, and we were able to literally teach. I piggybacked on a program that was already going, where they were using pictures for language. So a male teacher might be a stick figure with a ruler, and a female teacher might be a stick figure with a triangle for a skirt. But they needed to advocate for themselves, because in India, for every 100 rupees that comes down from the federal government, 5 makes it to the actual person that needs it. And so teachers would collect their salaries but not show up for work. So we designed a spreadsheet on paper that they could then erase or use as a template. And if it was a male or a female stick figure teacher, and then a circle for yes and an X for no. And then we took that data and translated it into actionable data for the government to see, for them to see where the graft was and where funds were being milked off. After Georgia State, I was with the American Cancer Society. I was hired on with them in 2013 as a health systems manager for primary care. And I worked in quality improvement in primary care through the cancer screening lens. And so we worked with federally qualified healthcare centers, FQHCs. So these are federal entities that pull dollars down to take care of the uninsured and underinsured. So last year, for example, we had a little over 50,000 patients. About 80% of our population is underinsured, so Medicaid, or uninsured. So ACS, I was looking at colorectal, breast, and cervical cancer screening rates, and how we could work with the providers, nursing staff, clinical staff, front office staff to help improve compliance. So when you go to the doctor, if they ask you if you had your mammogram or pap smear, or dentist, if you floss, if you say no, that's a gap in care. So we were working with these organizations to close those gaps in care. After 6 years with the American Cancer Society, I was hired on with True Health, which was one of the FQHCs I worked with, as the director of quality. So I went from 3 to 4 different measures in cancer to over 60, 70 measures as Karen manages now over the entire health spectrum. So, and we're in primary care. We also do OBGYN, podiatry, behavioral health, and dental. So anything that you can imagine that the provider asks you or that you might have wrong with you, if it's preventative and you say no, that's a gap in care. And as a quality team, we looked at how to train the providers and the clinical staff to ask those questions and educate the patients so that they say yes and they close that gap in care. So I did that for 3 years. And then in January, I was just recently promoted. I'm now the chief operations officer. So moved away from clinical, even though I'm not clinical by background, nurse, MA, or doctor, was overseeing the clinical side of things and quality, and back into operations. And so I oversee outreach and enrollment, which are the teams that when you hear about open enrollment for healthcare. So we have internal navigators and certified application counselors that help sign up uninsured to get insurance, even though Florida is not a Medicaid expansion state. I oversee facilities at all 8 of our sites and our monoclonal antibody infusion center. So 9 sites in total. The custodial department, operations, so we have a staff of about 350, 40 providers, about 50 clinical staff, and the rest all belong to me, whether they're facilities or PSRs up front. That's all under my purview. And public health is important to me, and it's in one of my other answers as well. Everything is public health, and public health is everything. And you've learned that, if you've ever had a class with Dr. Lynn, he's also said that as well. Anything that you can imagine affects your health. And it's now you're in a great time because of the pandemic. And I think we were talking about this when we met yesterday or 2 days ago, that public health is at the forefront. Budgets are not being cut like they usually are. There's actually money going into it. So I'll stop there and I'll pass it on to back to Evalye and Mike.
Wow, thank you, Nurez. I appreciate that. Yeah, that was a really good quote. Public health is everything, and everything is public health. That makes so much sense. I'm sure we'll dive a little deeper into it. But yeah, we'll definitely pass it on to Mikeundy to talk about his particular background.
Yeah, thanks. Glad to be invited to this and everyone to join and learn about our experiences. So my name is Mikeundy. I'm a senior business intelligence developer at Piedmont Healthcare. My professional journey, I think like Karen's, has been winding and not always with a clear destination in mind. Began my undergraduate as a physics and astronomy major, realized pretty quickly that you have to go to class and do your homework to be successful at that. So switched my major to literature and graduated with a very unspectacular undergraduate degree. I knew that I wanted to help people. I knew that I was good with my hands. So I gravitated towards the fire department. I got on as a volunteer firefighter with Alpharetta Fire Department after finishing up my undergraduate in Athens. And through that process, became acquainted with EMS. Fire departments in a lot of places will do joint responses with ambulances to treat sick and injured people. And so fairly quickly got into an EMS class and realized that the medicine aspect I found much more interesting, much more potential there to continue a life of learning, that you can spend your entire career in medicine and still learn something new every day. So I was pretty hooked pretty quickly. As soon as I finished with my EMT certification, went right back to Gwinnett Tech to get my paramedic certification. As a through the course of that training, you have to do a lot of ride-alongs in ambulances, practicums at various healthcare facilities and whatnot. I did several third rides with Grady during paramedic school and realized that was where the action was. Got hired on with Grady EMS as a paramedic shortly after completing my certifications, spent almost 6 years there, helped develop a critical care transport team, was really looking for kind of what the next step is as far as my career growth, and really hit an obstacle in that there are silos in our healthcare training, in that EMS certifications don't transfer readily into the certifications used largely within hospitals, be it, nurses, physician assistant, PAs, that basically I couldn't transfer any of my medical education up to that point over to a higher degree without kind of getting back in. If I wanted to go to nursing school, I would basically start at the bottom. So I was looking into physician assistant programs because that way I could leverage my undergraduate degree and my experience. Really wanted that to work out, but understanding the reality of the situation that these programs are very difficult to get into, I put into the Georgia State School of Public Health MPH program as a backup, not really having a great idea of what you would do with that education or how I would apply this to the future of my professional career. But as fate would have it, I got rejected from the PA program and got into the School of Public Health program. At around the same time, I had been working as a PRN research coordinator for an Emory research outfit, and they had another person leave the team, and I was offered a full-time research gig with Emory, and I kind of got plunged into the world of research and public health and found that the work that I was doing to get paid was a fantastic fit with what I was learning in school. It came time for me to write my thesis, and even though I was a policy and management focus, I chose a very technical research question that found that I lacked a lot of knowledge that I needed to pull off that analysis. And over the course of the next 6 to 9 months, I don't recommend that you base your thesis writing timelines off of what I did, but basically stayed up and taught myself a lot of how to use statistical software, a lot of how to do these type of analyses, and really kind of fell in love with the process. So after writing my thesis, started looking around at different jobs, and one of my former coworkers at Grady was working at the Piedmont Heart Institute. They had a position listed for a clinical intelligence analyst. And so we spoke, and I realized that I had kind of stumbled into this combination of skill sets that is actually very desirable. That, like Karen, having this kind of medical background, but being able to add technical ability and knowledge of how to gain insight out of data is actually not a terribly common mashup of skill sets, and found myself through little foresight of my own in a I think positive career outlook based on what I was able to do and the value that I was able to bring to a team. So I got on with Piedmont shortly after graduating from Georgia State in 2015. I have been there since. We have grown drastically as a healthcare organization just in the last 6 years. We had 5 hospitals when I started. We're up to almost 20 now. Our BI team was just a handful of folks, and now I think we're north of 30 people. And so there's a lot going on. I can save kind of what our daily day-to-day work is like for a little bit later, but that's kind of how I got to where I am.
Thank you so much for sharing that. I like that you were able to find your place and space into public health. And, you know, I think that's a story for a lot of people. They're either in a position where they aren't sure where they're going to go, but it definitely shows, you know, the growth. Your path definitely shows your growth. So I appreciate you for sharing that. All right, so thank you so much. We're going to go on to the second question. All right. And I feel like a lot of you kind of started to answer this question, but I wanted to know what drew you to pursue basically the healthcare setting. You know, what was it about the healthcare setting that you said, you know what, this is it for me? And we'll start with Karen.
Yeah, so I think for me, it definitely at the core of everything was the desire to help, right? The desire to help someone, the desire to do something good outside of yourself. Where public health kind of shines is just that, right? The public, the idea of helping more than one person at a time. And I think that's why the idea of not becoming a doctor kind of didn't hurt so much, because when you're a doctor, while it is phenomenal and it is a great, you know, career path and a vocation in it of itself, you do help one person at a time. And where I could comfortably say I'm okay not becoming a doctor was when the work that I do, when I do certain things, even in my current position where, you know, when I left Grady and went to what they call the payer side, which is the dark side, right? Because you're in the insurance company. I work in a very different arm of the insurance side. And it's anything that I'm the voice of the patient to the evil insurance company, right? I'm like, this is not helping the patient. This is not, and here they still call them the members, but I call them the patient because my mindset always came from the hospital setting. So I'm like, you're only helping one member here, whereas my solution, because I have the concept of epidemiology, because I have the concept of population health and public health, I'm like, if you do it this way, you could help 1 million members, you can help 1 million patients, right? And it's the concept of ability to help more than just one person at a time or hurt less people at a time. And that's kind of the core of why I do what I do, right?
Yeah, I love that you create more of your impact in what you're doing. And I think that's a beautiful thing. I'm all about impact and making sure that I can touch as many people as possible, because, you know, there are people who don't vouch for a community, or they're not interested in the bigger picture. But I like that where you are in your life professionally allows you the ability to do it. So it's a great thing. What about you, Mike? What about you? What drew you to the healthcare setting?
So I think Nurez and I are going to have to scramble because Karen just stole all our thunder there. But so I think, like her, it was definitely a desire to help people like her see the efficiencies of scale from doing this work, not on a one-on-one basis, but from a 30,000 foot perspective, where you're able to look at this not as this single patient, but as this group of patients. And that's actually a really big difference. I will say that there are, you know, so maybe then I'll just transition the question a little bit as to from the initial draw into what's keeping me in healthcare. Getting to see the insight that you have provided to decision makers flow through to changes in policy and improvements in outcomes is about the best payment for anything I can conceptualize. Seeing at an aggregated level, a group of patients is doing better because of the information that you were able to distill and communicate is really rewarding. There is a lot about our healthcare system that does not work well. There is a lot that it can be very frustrating and demoralizing. I think one of the things that really helps me kind of get through those low points where I'm working on a project that's really difficult, or I don't have a good, real life grasp on how this is helping, is the people that I work with. The team that I work with at Piedmont are some of the most skilled, intelligent, and helpful people that I have ever worked with. And that has really been the delta for me to get over some of the less pleasing aspects of our work that I find tough to overcome. It's really working with a great team and people that are genuinely interested, invested in your success. And even if you're maybe not enjoying the work so much, at least you're enjoying who you work with.
That's a beautiful thing. I wish a lot of companies were like that. So the fact that you found that, and people that are invested in you and value the work that you do and you're able to see it impacting on such a large, diverse, complex scale is just, that's definitely a reward you can't get anywhere else. I love it. I love it. All right. Well, what about you, Nurez?
So as I mentioned earlier, and Mike, I agree, Karen stole all of our thunder, but I went back to school in 2010 after being out of school for 14 years in order to figure out what I wanted to do when I grew up. And public health was a career change for me. I heard a young lady speak about what she did at the CDC. I was hooked. I asked her to coffee. I networked. I did my research. I read about Paul Farmer. I was going to save the world. I was going to be the next Paul Farmer. And, I still am influential in my sphere. I get to make the decisions, as both Karen and Mike have mentioned, that don't just impact one person, but hundreds or thousands of people. My father's a provider, and that's what turns him on. He likes the puzzle in family practice of, here's a set of either morbidities or complications or symptoms, and he figures out what's wrong and he treats them, and then you continue on, especially in this day and age where everybody has comorbidities. But being able to take my business background, my networking skills, how everything that we learned in EPI and in policy management, and how to get decisions and policy decisions made, what turns on the policymakers, the politicians. They're not all evil. Insurance companies aren't all evil. They all have priorities. They're different from ours. How do you bridge that network in order to not only provide the care that affects or saves one person, but affects and saves thousands of people. And there's no greater, story or example. When I was in school in 2012 and I graduated, the Affordable Care Act was just coming around. So we spent a lot of time studying that and what is wrong with healthcare today. You guys have the opportunity to look at what happened with the pandemic and the learning that happened, how scientists were almost panicking based on what they were thinking from the Spanish flu, 1918. But, they couldn't communicate to the public that it's not perfect. We're trying to do things. And by trying, we find those solutions. And that's not to discount sometimes, and Mike, I think you mentioned it and you said it very well, and I'm going to butcher it, minimizing the hurt that we cause too. That's important to look at of how does this decision, just because one decision, while we're using our efficiencies of scale, we're using our epidemiology knowledge, there are always people that are not affected positively by our decisions. How are we going to then help them? And I have the opportunity in healthcare, specifically at my organization, where we have 50,000 patients. And if we make a decision, we also have the ability to make the exceptions.
I think that's a big deal. I really do. And I love, like I said, I love that the fact that you all are able to see it in from this particular stance, from this particular viewpoints and lens, because it is important. Everybody, we did have a great opportunity to learn and grow so much because of the COVID, crises. And I think that has really made a big turn in the world of public health and what we are accustomed to. So yeah, I once again thank you all for answering those two questions. Now, because of the sake of time, I am going to go to the next question, but the last two questions I feel like could be something that maybe could potentially be a group discussion versus everyone answering one-on-one. So the next question, and I feel like that you all answered this in the last two questions that you've had, or just in bits and pieces, but and feel free to chime in after this, but what role do you play in improving healthcare delivery? And that could be specifically tied to your profession. It could be specifically tied into maybe you do things outside of your professions that's more in alignment with community outreach. But what is it that you do to improve healthcare delivery? And anyone can answer this question.
I think you're right.
I can start.
Okay.
So I can kind of talk through what my team specifically does and then how it makes a difference, brings value to the organization. So healthcare has probably the most copious, dirtiest data of any data set that you can find. I think historically we have collected every scrap of measurable data about our patients, regardless of whether or not it will ever be looked at again. We have relationships. So our team is set up so all of our customers are internal customers. We have different sprint teams. So if anyone's not familiar with the agile methodology, it's basically you work on a regular cadence. For us, it's 2 weeks. So we have 2-week sprint cycles. We basically groom all of the work that we do at the beginning of that, and then have regular check-ins over that 2 weeks. And then at the end of the 2 weeks, we, are accountable to the work and looking at what the next pieces are. And so we have these sprint teams designed by who they serve. I am on a team called the Provider Metrics. And so it's a lot of working with different care groups, usually based around what type of medicine they're providing. and they help design how they want their metrics defined. And then our team kind of ingests that information, goes looking through the data for the different pieces that we're going to use, add logic to it, and then put it up in our visualization software. So I think through that data request ingestion process, grooming, there's a very methodological way that everything happens, that there's transparency to the people that requested these items, how it's coming along, what obstacles we're seeing. And then once these things are realized, these products are created, they are then able to integrate that insight into their work and their decision making, and that's how we move the needle here.
Awesome. Karen, did you want to?
Yeah, I think similar to Mike's response, right? One of the things that I guess for me, I hire people, right? I have a team of analysts, and I need to make sure that the people who I work with have an understanding of what potential products are. We are required to have and innovate solutions that are going to be productive to the client. And our clients can vary the gamut, right? They can be internal clients from within Anthem, but they can also be external clients, right? Like I mentioned, we work with Google and Apple and Amazon, as well as researchers, clinicians, hospital systems, and various other people, right? Clinical trials people. Some of them are also just business people who don't understand clinical or anything, and all they're looking at is the ROI, right? The return on investment. So I've got to have people who understand what could potentially help or hinder a member, a patient. And so we're always here, and I have a team of 9 analysts, and my analysts, half of them have MPHs. Some of them are in education, infectious disease education. I have a couple of physicians who also have an MPH. Some are lab techs who also have an MPH. And so that MPH for me has always been important because they understand population health. And when we do that, we always seem to have this ability to think outside the box. And we tend to always think more than, right? It's like, how can you address something and then think 15 steps ahead, right? We think policy, we think, how can this help? Because that's the beauty of the required core courses that we always have to take. And that's the beauty that no matter whether you get it at Georgia State or Emory or wherever there is a core that you take that makes you think about basics, right? My focus was epidemiology, right? But I took additional courses in biostatistics. So I handle all of the math stuff in our department, right? And I work with all the data scientists and all the AI applications. So everything that's AI and algorithms, those projects come to me. Everything that's policy-based goes to my policy team, right? Everything that's education and everything that's all about education goes to my education people and the people who focus on education. And then that's the reason I hire my team the way I do. And like I said, we're not just MPHs, but we have physicians too that happen to have an MPH and they think differently. We have a different way of approaching things. And so we play a very pivotal role, because then when we attack certain projects, we don't just go, hey, here's the ROI and this is how much money we're going to make. Now, when I first came into this industry, I wasn't making any money because I was working for NGOs. But as I came in and, I said, there is a way to make money here without hurting, the people, right? And we now come in, and as I'm in an industry where Anthem, if you look at it, we do make money, right? But I get to go to my board and I say, hey, we can also help. And we have these huge, social determinants of health projects that with the insurance company, costed by the insurance company. We have Habitat for Humanity projects. We have Meals on Wheels projects. We have SDOH projects that we now go, and we have the data that we can prove that if we do this, not only are you helping the member, but you're also saving yourself money, because the better the member lives, the better it is for us both equally. And we know that because we're public health people and we can make that argument, right? It's a win-win situation. But it takes that public health mentality to make that argument. And then it also takes that ability to statistically prove it and have evidence-based decision-making, because the people in the C-suite that we're constantly meeting with need that to prove to them that it's a good business decision to make. And thanks to all the training we get, I could stand toe to toe and meet with my COO, my CTO, my CFO, and have these constant meetings with them. And that's where we come in.
Wow, that's a big, that's big for someone to know. I love that you're able to speak to those different levels or varying levels, because it does go back to what we were talking about earlier and how broad it is, but how you're still able to speak to the, the technical side, the business side, the C-level side, and all of those sides by just simply having the public health mentality. And I think that makes a lot of sense. I am going to move on to our very last question. And I'm sorry, Nurez, did you want to add to this question?
Just 30 seconds.
Yes, sure.
If you listen to what Mike and Karen both said, and it's actually in my notes here, they found what turned them on when it came to the data. We have a ton of data. I have 50,000 patients. Trust me, just like Mike said, I have tons and tons of data. Well, it's SDOH data, it's ethnicity, it's race, it's where they live, it's how they're living, it's the meds that they're on, it's diagnosed. I mean, anything that you want. And now, thankfully with EHRs, we have the ability to run reports on that data instead of just pulling it out of paper. Find out for you, do you want to actionize the data in AI or BI? Do you want to actionize the data and go to toe-to-toe, like Karen said, with the CFO saying, hey, you don't want to spend $10, $20, or $30,000. And these are the types of conversations that we have. But if you do, you will end up not only saving $150,000, you'll make, right? And so what turns you on about that data? Is it the epi side of it? Is it going toe to toe with the politicians and saying, here's the data about COVID. Here's what we could do. Here's the effect of what you're going to, this one program that you're going to cancel. Here's how it's going to affect the downstream and what the downstream effects are. So for all of you listening, think about the data. Think about what role you want to play in that data.
That's beautiful. Thank you so much, Nurez. I appreciate it. Great advice for those that are listening. And now on to our very last question regarding career. I know just from being in the career services sector here at the School of Public Health, I'm always pulling for resources and tools to answer, which way do I go? What now that I have my epi degree under me, should I become an epidemiologist? Should I go to the CDC? Should I do something different? I don't know. I get that often from just every aspect. And so I want to ask you three the question, what advice would you give to a student that is currently on our call today, who may be currently graduating and considering work in the healthcare industry? And maybe not just in the healthcare industry, but in public health in general, because we know that in the world of public health, you can utilize your degree and go many places now from our discussion. So what advice would you give to someone who's kind of still pondering what they should do next? And this is a free for all.
Yeah, I can start. And so, when we were talking the other day in that practice session, my daughter's 19. She has a semester and a half left at University of Buffalo. She's decided to study psychology, and I think she's minoring. She flips back and forth between criminology and sociology. So every time that we see something new come out on the news, every time that Apple releases a new feature, every time that she watches CSI, every time she sees a commercial, I ask her, what's the psychology behind it? And literally, she's like, well, what do you mean? When we first started having the conversations, these companies hire psychologists and epidemiologists and public health professionals to educate them about what affects and what will turn the consumers on. What and how is it going to affect patients? My daughter is probably similar to many of you that are listening, whether you're on live or on Facebook Live. She's not very social. She doesn't like to talk to people. That's just the day and age that kids have grown up with. My kid has grown up with. I'm not sure the ages of all of you. But if you are one of those people, you have to break that shell. And this is exactly the same thing that I tell her. It is not Evalye's responsibility to get you a job. It's your responsibility to Google, find out what turns you on, figure it out, and then go ask Evalye and say, hey, I think I like to do this. Can you guide me for further education? Can you introduce me to somebody I can go buy a coffee for, just like I did, and get 3 names from that person after you interview them for an hour? And then go call those 3 people that they give you and interview them for an hour. Let me tell you something. People love to talk about themselves. Why do you think the 3 of us are on this panel? We love to talk about ourselves. We didn't even get a free coffee out of it. But by getting out of your shell, go talk to your professors. Don't make that, they're not going to come to you. They're busy. They're doing research. They've got other students. They've got families. They've got things that they're working on. It's your responsibility to figure out what turns you on. How are you going to use your degree? And that may change, and that's okay. Figure out a plan and then write it down. I'm sure you've heard your parents say, or you've had older siblings or cousins or family members or friends, man, you know what? I don't know what happened. 10 years just went by just like that. You know why? Probably because they thought they were going to do something, but they never wrote it down. They never had an actionable plan that they went back to and they referred back to. It's okay to change your plan. I changed my plan. I owned a nightclub. I was at the pinnacle of my career. I didn't have to do anything else. I was making great money. And I said, hey, you know what? Staying up till 5 o'clock in the morning is not what I want anymore. Now I get up at 5 o'clock in the morning and go to the gym instead of, getting people boozed up all night. But what is your story? And then you cross it off on your piece of paper and you write a new plan in. That is what's going to get you ahead. Finding out, using the mentoring programs, talking to your parents, Georgia State, talking to Evalye, the connections that you have, and then put in the long hours. When you have that mentor, do the work that they're telling you to do. It's not that they're giving you busy work, even though that's maybe what it seems like. They're telling you what worked for them. And maybe it doesn't work for you. But if you have a series of mentors, if you have 3, 4, 5 people or experts in your life, talk to all of them. Figure out what works for you, but then do it. And write it down while you do it, so that you don't come back here. Today is March 31st, 2022. You don't come back on March 31st, 32 and say, man, 10 years went by. Those guys, I was on that panel 10 years ago and I had these plans, but what the heck? I have no idea what happened. That's all I got.
I will echo what Nurez said, because I'll be honest with you, I never believed. I thought it was a load of bull. And I have about 10 of these books. Each of these track some of my things. I, believe it or not, if you hear me here, I am not a people person. I am the person I am a hermit crab. During my lab years, I could spend an entire week in a dark room counting cells and I was happy. Being here in front of you talking is horrible, especially because I'm not a people person. But the biggest recommendation I can always give, and the thing that has always propelled me, one is I am married to the most amazing husband who is the most supportive person, and it's find the people who will support you and really surround yourself from people who will always propel you forward. And raise your hand and volunteer for the things that scare the heck out of you. You may feel, I always live by the 80, I'm severely methodical, as you might see here. I'm very mathematical. I'm very, that's just how I work, but I live by the 80-20 rule. If I feel 80% confident in me doing something, I may be scared to raise my hand and I'm shaking as I'm raising it, but I'm going to raise it and I'm going to volunteer. That's how I was able to go travel the world. I worked with Unitar and I traveled the world while having a baby in tow. And my husband supported me with that. We lived overseas for many years doing that. Best experience of my life. This is how I got headhunted, because I scaredly raised my hand and I presented in front of a C-suite and they loved me. And I thought I bombed in most of these presentations. And then I got a call from their tech and they said, hey, we want to hire you. And by the way, it's twice the salary you're making today. Right. Mm-hmm. And I went home crying to my husband thinking I totally bombed this presentation. And my husband's going, no, you rocked, because, and I now have a nice group of, as Nurez mentioned, mentors. And I go and I ask and I say, what's wrong with me? Tell me what it is and what I need to improve by myself. And the people that surround me tell me what it is, very lovingly and very, productively. But it's, and then you do, and you even today, I take courses from MIT and all these other places, not because I feel like I'm stupid, but because you're always learning. So it'll never stop, because technology, epidemiology, public health continues to change, because humanity continues to change. So yes, today you graduate. Guess what? 2 months from now, you're going to continue to graduate on something else. You can get a certificate in something else. Today does not define your tomorrow. Whatever decision you make today continues to define you. So make a decision today, make a decision tomorrow, and just continue moving forward. So you messed up today, good. You get to mess up again tomorrow. Do it again tomorrow. And even if you're scared, raise your hand, volunteer. They can open the doors to the most amazing opportunities. They sure as heck have done it for me. And I've done things that a very poor Hispanic person never thought she could do. And I have today thousands of passport stamps paid by other companies for me to go experience everywhere in the world.
That's amazing. That's really great advice, because I do hear from students who are afraid to raise their hand, who are afraid to reach out coldly on LinkedIn to network and to ask for mentors and to just ask.
That's the worst they can say is no. Okay, then I go to the next no.
Yeah, and that's it. I think that's great advice. And with 2 minutes left, I'm going to give it over to Mike to let him answer this question, and then we'll wrap it on up.
Yeah, so I will echo what my colleagues have said, and that nothing ventured, nothing gained. Don't be afraid to make a mistake. Not everything, like I feel like as far as your career choices go, you're not really making mistakes. You're learning, you're building your experience and growing your knowledge. And you tried something, it didn't work out. Well, it's not a failure if you learn something out of it and you know better what to do for next time. There's most of us got here through the attention and guidance of those before us. And I find that the culture is very strong in our community to continue paying that forward to the next generation. So most of these people, when you reach out to them, I would agree with my colleagues that quite the opposite of saying no, that they are going to jump at the opportunity to talk about themselves. The only other thing that I wanted to say to students that are trying to determine what path their career in public health is going to take. A couple of others have mentioned that I think at this point, really, there's really a public health aspect to nearly any type of job that you can get. And especially over the past 2 years and everything that society has learned about medicine through the pandemic, that these things are now top of mind, whereas they were kind of afterthoughts before. And so if pure medicine or pure healthcare isn't for you, then look for where the application of public health can be applied to that thing that you're really passionate about. And if it doesn't exist, maybe it needs to. The healthcare setting that we work in can frequently be challenging and frustrating and nonsensical and hard. But that doesn't mean that it's not really rewarding when you solve some of these problems. And we need smart, dedicated people in here with us to help kind of break through some of these walls and think outside the box and come up with innovative solutions to our 21st century 22nd century healthcare problems.
I agree. I definitely agree. Being an advocate for yourself, creating your own lanes if you need to, never being afraid to ask those questions is highly important. So I definitely want to thank you all. Yep, somebody's saying thank you all. So thanks so much. Everyone's answer to question 2 is why she recently went back to school. And this is from Samantha Lewis. So hopefully you all can see the chat. She spent 10 years as a family nurse practitioner in primary care, and her goal is to transition from helping patients on an individual level to helping on a larger scale. So she has learned a lot from you all today. And anyone else, feel free to place your questions in the chat. Because of time, we are going to wrap it up, but if there are people who have questions and want to hang out a little bit afterwards, feel free to do so. But once again, I want to thank each of you. I really appreciate each of you for attending the Currents of Public Health webinar today. A special thanks to Nurez, Karen, and Mike for this thoughtful presentation and conversation. I hope that for a lot of you, it was very, very helpful. But in closing, the School of Public Health at Georgia State, for those who are unfamiliar with what we do and what the programs that we have, the School of Public Health is one of the most diverse schools of public health in the nation. We offer a Bachelor's of Science in Public Health, a graduate certificate, Master's of Public Health degree in 5 concentrations, PhD degrees in 4 public health areas of knowledge, and a Doctor of Public Health degree. The faculty and students conduct cutting edge research on some of the most complex 21st century public health challenges facing cities all across the globe. So our work is definitely carried out in partnership with communities like this, like we've been building through our Currents webinar, through our residents, through community-based organizations that are committed to health equity. So if you are someone who is thinking about the School of Public Health at Georgia State, or would like to get more information about our programs or how to support the work of the school and our students, please visit www.publichealth.gsu.edu, and that should get you to where you want to go. On the screen, what you're seeing is the contact information of our speakers today. For the ones that are in attendance and the ones that maybe you registered and just weren't unable to make it today, you will get this presentation, and everything is hyperlinked. So you'll be able to click on the links to get to their LinkedIn page and type them some emails, or just slide into their DMs if you have some additional questions for your career. And once again, if you are somebody that is interested in speaking in one of our Currents webinars, please reach out to me. My contact information is here at the bottom at elawson2@gsu.edu. Equally, we also have an alumni mentoring program. So if you are an alum to Georgia State and the School of Public Health, we would love for you to participate. We could definitely get some information over to you. Obviously, it's free to participate, but it is a great program to align those professional backgrounds, that professional experience for our MPH students, and just guiding them of how to just navigate the world of public health, how to navigate, how to brand themselves, how to position themselves appropriately before graduating. And currently we piloted the program this year. It's over in a few weeks. I think it ends in April 15th, April 16th, if I'm not mistaken. But the students and the mentors, currently we have about 34 people in the program, and they have found it to be an amazing program, extremely helpful. So, and of course, Mike and Karen, I'd love to pass the information on to you. I've definitely passed the information on to Nurez as well. But if there's anyone who's listening, please know that you can reach out to us. And then of course, we'll pass that on your way. Did I hear someone getting ready to ask a question? No? Okay. So once again, thank you so much. I appreciate you. Onward and upward, guys. Have a good one.